Hi, my name's Jodie. I'm a Kamilaroi Aboriginal woman and I'm a social worker at Forensic Medicine Newcastle. And our role is to support families through the coroner's process. So we make contact with families so families are aware of where their person is, what's happening with their person, and when they can start making those final arrangements. This job, I've been doing social work for a number of years. This is one of the most rewarding jobs I've done. Is to be able to support families in a process which is very alien for them, and empower them to have some of that control back when it feels like all that control's been taken away.
Aboriginal and Torres Strait Islander families are overrepresented in this part of the health system, as well as every other part of the health system as well, with preventable and untimely deaths. So for us, in how we provide culturally respectful care for the person who died, and the respect for deceased persons underpins everything that we do at Forensic Medicine.
So when I joined the team here, they'd already started a process to enable smoking ceremonies to occur. So since I've been here, we have had a couple of those ceremonies occur for people that have come into our care and for families. We also have some beautiful quilts that have been donated by local Aboriginal elders and community members, and we use them when we have someone that is where families are wanting to spend some time with their loved one.
We know that one size doesn't fit all, so we ask the question, is there anything in addition to the care that we provide for for your family member, that we could do additionally to provide extra cultural respect or care. Some of our local elders and community members have painted gum leaves with traditional and contemporary Aboriginal design.
The painted leaves started with a reef, and it happened because I had a family member, one of my aunts. She has one in her house. And one day we were sitting around the team and we were talking about how we can best support people culturally in their time of grief. Another family member wanted to paint some leaves, and then it just developed to how about we get the gum leaves painted to leave with their person. So these are the leaves that we have, and as you can see, there's lots of different colours and designs. And families would just run through and pick something that they really find a connection with. For families where they are out of area, we would ask them some questions and get to know their person a little bit better so that we can better pick those leaves for them. So once families have picked their leaves, we'll bring them through and they're able to place them with their loved ones. When we speak to families, we talk to them about the leaves and who created the leaves and who's painting these gum leaves for them, and they're really touched. I think for families that are taking those leaves, it's about continuing bonds. So it's having that bond continue beyond someone dying.
It's a bit of a contemporary take on sorry business. So for us, we're always looking for ways that we can provide a really culturally safe and respectful service.
I think it's important work to acknowledge, particularly for Aboriginal families, that there is that care and time taken to acknowledge their Aboriginality, and that is in our everyday work, and that people are making that acknowledgement for them. I think because of the over-representation of people in this system for Aboriginal people, it's high, and it's really heartbreaking. But I think the staff, all of us really, and the care and the kindness and the time that's taken to acknowledge that and to support those families through the difficult time is really rewarding.